Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a veterinarian called Dr. Han Philip giving a presentation. You now have 90 seconds to read questions 31 to 36.
Hi, I'm Dr. Han Philip. First of all, thank you everyone for coming here tonight. Dogs can have a variety of back or spinal diseases and injuries. Slipped or protruding discs are very well known in longer back breeds of dogs like Dachshunds for example. But a disease you may not have heard of can be very devastating, and I have an interesting case to show you. The disease is called Wobbler's syndrome. Tucker is a 3-year-old rescued dog, who is very loved by his adoptive family. He is a Great Dane, but because he's adopted from a rescue, the family did not know anything about his medical history or breeding. However, at about 8 months after coming home, Tucker began showing some very subtle signs of lack of coordination and slipping on tile floors. Then one evening in normal play, he yelped out with severe pain in his neck. The next day, routine X-rays of the neck revealed a suspicion of a cervical malformation in the last 3 neck vertebrae. He was sent to a specialist in neurology for an exam and even an MRI, exactly as we have in human hospitals. It was done under a general anesthetic. The MRI shows very clearly 3 cervical vertebrae that are thickening and pressing inward on the spinal cord. This is called spinal stenosis, and it will cause slow progression of weakness and therefore the name Wobbler's syndrome, and eventually it will cause paralysis and, unfortunately, early euthanasia. It is an unfortunate and sad disease seen in many breeds, especially common in Doberman and Great Dane. The first signs are usually seen at 4 to 6 years of age in Dobermans, but much younger in Great Danes. The owners typically see their dog become wobbly or uncoordinated. You may hear of cures such as feeding low-calcium diet and acupuncture. But none of these things have been proven to be of real benefit. Some Wobbler's dogs can be managed on steroids and restricted activity, but the only real cure is a spine surgery called modified dorsal laminectomy. It is a surgical procedure of the spine, which aims to provide access to a prolapsed disc and therefore relieve pressure on the spinal cord. This surgery can take place only once the location of the trouble spot is known. This procedure is also used for dogs with severe neurological damage to the hind limbs, bladder, or bowel, as a result of spinal cord compression. Dr. Larry Newman, a board-certified specialist and neurosurgeon in private practice at the Veterinary Referral Center, did this surgery on Tucker. It is an extremely delicate and precise operation. Special instruments are used to remove the tops of the affected vertebrae, which then decompress the spinal cord and allow it to function without the damaging pressure that will eventually cause pain and paralysis. Immediately after surgery, it is important the dog has strict rest for a period of weeks, to allow swelling and inflammation to subside. The dog requires appropriate pain relief, and for those with impaired limb or bladder or bowel function. Nursing care is essential to prevent bed sores or urine scald. In the intermediate term, physiotherapy such as hydrotherapy, massage, and passive movement exercises can help to maintain muscle tone and aid recovery. This allows the muscle to reattach to the operative area. Today, Tucker is recovered and a happy, healthy dog, who will live a normal life without worries of pain or paralysis. The cost of diagnostic scans is significant, at around $800 to $2,000. The surgical expertise and equipment needed means this is an expensive procedure, and you should expect to pay anywhere between $1,500 and $6,000. It should also be borne in mind the dog may need intensive care for a few days following surgery, which costs around $600 per night. Since the Tucker's owners had purchased pet insurance, the company paid 90% of the total cost and is a perfect example of how pet health insurance really pays. Tucker's owners caught these symptoms early, and it was really helpful for both the veterinarian and the specialists to work together for a perfect outcome. This also demonstrates how early detection of any problem and the help of the whole veterinary care team is so important for the precise treatment and complete cure. Where there is a recognized predisposition to disc disease, such as in the Dachshund, the owner should avoid activities which place strain on the back. In addition, at the first indication of back pain, the dog should be strictly rested and given pain relief. Dogs that show signs of numbness on the back end, such as staggering, weakness, or poor coordination, should be rested and see a vet as soon as possible in order to receive appropriate therapy and limit damage.
Extract 2. Questions 37 to 42. You hear an ophthalmologist called Dr. Ralph Peterson giving a presentation. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Ralph Peterson. I'm an ophthalmologist and a specialist in photochemistry. I will be talking about the genetic model and how does it fit in optometry. Well, genetics is being incorporated into medical care in terms of dealing with disease, and specifically in one of the really critical areas of pre-symptomatic evaluation, or in other words, it's being able to intervene before the symptoms. The advantage of that, of course, is that you delay the onset of the disease, and then, when it once manifests, you can delay the progression hopefully, and also decrease the severity, and things like that. So, this is already being done, and interestingly ocular disease represents really a better sort of venue, so to speak, than systemic disease, because there are a whole bunch of ocular diseases that result from a single mutation in one codon. Lots of these systemic diseases like heart disease, hypertension, diabetes and other things, the genetic contribution is very complex. There are multiple genes and multiple sites, and there are all sorts of complications and complexities in terms of applying that to actual clinical care. Even though it will be done, but it will take a longer period of time. There are all these studies going on like the 1000 Genomes Project. The genomics is already being applied in terms of ocular disease. I read a paper where they were looking at mutations in rhodopsin. If the mutation occurs in that area, it tremendously affects how rhodopsin responds to light. It does so because the rhodopsin to respond abnormally, and it does result in disease. But it's not quite as drastic as in the first sign. We were able to show this with standard measurements that one would do in a clinical setting, such as visual acuity, visual field diameter, dark at that sensitivity, ERG amplitude. But, it's not something that optometry is identified with. There are two categories. The first category is genetic testing, useful in terms of the things that I mentioned. I think the second issue is in terms of optometrists dealing with ocular disease. The public recognizes optometrists as being viable health care providers in terms of ocular disease, and I feel now this entire thing could be in jeopardy if optometrists don't get involved with genetics. When someone presented with some sort of ocular disease, we are already at the 5-year point. It's not a question of if this happens, it's a question of when it's going to happen. Okay, I have no idea when it's going, but it's going to happen, and optometrists are completely unprepared for this. So what does that mean? Let's say some point, that's what the ophthalmologists start to do. In other words, you go in for an exam for an ocular disease and they will draw blood and send it out for genetic analysis, and optometrists aren't doing this. So in terms of the public perception, what does that mean? So in my mind, it's sort of analogous to, let's say you going to your internist for your yearly checkup and the person not drawing blood, to do, let's say a lipid profile, so who's going to continue to go to such a person? Most of the ophthalmologists are doing genetic testing and helping patients with that. In fact, I think just about everybody involved in ocular disease in the ophthalmology community is doing this as part of standard care routine. As I said, there are a few optometrists here and there who are doing it. But, it's not something that is recognized universally in optometry and, more importantly, as I said, we're not training students to get involved in this area. In terms of the mundane aspects, including insurance, I think there are 3 things in general that are happening, that are pushing genetic testing more and more into clinical care, ocular as well as otherwise. One is that the amount of money it costs to do the analysis is coming way down. The second thing is the length of time it takes to do an analysis is speeding up very significantly, and perhaps most importantly, the insurance companies are starting to cover the tab because they are beginning to realize that it will cost them less in the long run. So these are all important issues that are driving genetic testing into a standard medical care. Now, both nutrition and genetics are becoming part of issues that are important in terms of ocular disease and specifically in age-related macular degeneration. So, one of the things that has happened just over the last couple of years is some models have been set up which look at a bunch of different factors, including genetics, environmental, diet, nutrition, demographic and ocular factors that can predict how likely it is that someone is going to develop AMD, and once it develops, what the likely progression characteristics are going to be. But again, showing you how both these areas are becoming vital in terms of dealing with ocular disease concludes it. That is the end of part C. You now have 2 minutes to check your answers.